Thank you, distinguished ladies and gentlemen of press. Today we'll, of course, brief you on our daily communication from the Office of the President, and this is communication number 10. Then that will be followed by a press statement from the Office of His Excellency the First Vice President on the rumors that were trending today on the social media on COVID-19. Today's meeting, as usual, covered the situation of COVID-19 in the country, and we want to inform the public that South Sudan is still COVID-19 free, and we hope it shall remain so. The high-level task force also decided in today's meeting to co-opt more members, especially from the Parliament, and the chair of the Health Committee and Security Committee have been co-opted into the committee. Again, like yesterday and the days before, the high-level task force listened to the latest updates on the situation of South Sudanese students in Ethiopia, and in light of the change of heart from the government of Ethiopia to ask the government of South Sudan to take back their students during these difficult times of COVID-19. And the discussion considered a lot of facts, and this will be concluded in tomorrow's meeting. The high-level task force also was briefed on the desire of some citizens within the POC to leave the POCs and go back to their home towns and villages. And the high-level task force welcomes this, and also welcomes the gesture from the UNIMIS to assist in transporting these citizens to their home areas. The high-level task force encourages all dwellers of POCs to come out of the POCs and start rebuilding their normal lives at the places of their choosing. Finally, the high-level task force reiterates the importance of people observing social distancing, and advises citizens to adhere to the earlier directives on bans on the restaurants, shisha places, bars, clubs, playing cards in the open sky, with some degree of relaxation on the tea sellers, and they will be given guidelines on how to continue with the business, provided that they observe strict hygiene and health procedures, and also observe the rules of social distancing. This is to avoid close contact between the clients, but everything else remains it is on bodas, on rakshas, on buses, and the rest. Curfew remains in place from 8 p.m. to 6 a.m. Violators will definitely be arrested. That was and then the last point was the communique yesterday that came out of the virtual conference of the heads of the state and government of the IGAD on formulation of a regional plan to fight COVID-19, and the high-level task force welcomed the declaration and requested relevant government institutions and ministries to start working on costed work plans. Particularly the Ministry of Health and Ministry of Finance have been requested to urgently develop the plans in preparation for the virtual conferences of these institutions of the region. This brings us to the end of our daily communication. Many of you will have heard through the social media and some local media that there is confirmed case of coronavirus in South Sudan. And as I said earlier, we want to inform our people that there is no case of COVID-19 in South Sudan, and what was on the media was just a mere fabrication, and South Sudan has nothing to hide. And so I want to read this press release from the office of the first Vice President for the benefit of the media and our people. Press release, Tuesday, 31st March 2020, Juba, South Sudan. Office of the First Vice President. South Sudan has no confirmed case of coronavirus disease, COVID-19. The high-level task force would like to inform the general public that all the 18 samples collected since the outbreak of COVID-19 have tested negative for COVID-19 by polymerase chain reaction. And this is the standard test that is performed almost all over the world. And the same test that we do here is what they do in Kenya, is what they do in Uganda, and is what they do in South Africa. That similar machine that we have is the machine that is in South Africa, on which our own were trained. So there's no reason, we are using the same test kits. We're using the same reagents, so there's no reason to think that our tests in any way can be of low quality. There is no COVID-19 outbreak in South Sudan as we speak. I'm urging people to ignore circulating rumors about the outbreak of the deadly virus in the country. People should not panic and be scared of the rumors being spread by social and local media. The government, with support from partners, has put in place measures to identify, detect, confirm, and respond to a potential case of COVID-19 in South Sudan. As a country, we have established an isolation and treatment center, trained rapid response teams, and frontline health workers in readiness to respond to possible cases. In addition, we have also established screening points at border crossings. Active surveillance is at community and health facilities, and have been conducting community awareness with support of partners. The government reiterates its call to the general public to cooperate with the guidelines issued by the high-level task force to prevent the importation of COVID-19 to the country. COVID-19 is a dangerous disease. However, it is possible to prevent. I urge all South Sudanese who experience signs and symptoms like high fever, cough, and shortness of breath to call the toll-free hotline 6666 to seek help. The government of the Republic of South Sudan is working closely with partners to keep the people in South Sudan safe. His Excellency, Dr. Riek Machar Dorgon, First Vice President and Deputy Chairman of the High-Level Task Force. Thank you. If you have any questions, Manager and the Director of Public Health Institute is also ready to respond to any queries. My colleague here, Dr. Kwir, who is an independent researcher and a specialist in molecular biology, which is very much about this kind of organisms, can also assist with any questions that you may pose.
South Sudan, COVID-19 free? Is the lockdown not a problem to South Sudanese and the public?
We are not locked down. This is not lockdown, but it is about trying to put in place measures to ensure that we minimize the risk of spreading the disease. You don't know how and when it strikes, but it can happen. So you don't give chances, you don't take chances. In countries, we did not react early enough. They're now paying the price. And I don't think it would have been advisable for our government to wait until we have a case, then we start suspending international flights. Uganda did it, and now they are not paying the price. They waited until they got the case, then they reacted. Had we not reacted about a week ago, we would be having cases today. Same thing with our people. This is a fight that requires our efforts, all of us. And each and every one of us has a bit to contribute into this. One of those things to contribute into this is to accept these short-term difficulties that we're going to face in order to live safe, better to live hungry than actually to die. So we know our people are suffering, but also government is considering many other things, options like household to household food distribution. That is already in the plan. That if it becomes, should it comes to a total lockdown, when you will be asked to stay at home, when you will be asked not to move, when no shop should open. That plan is in place, and our Minister of Humanitarian Affairs and Disaster Management is very much working on it. So we are not also leaving everything for chance. In as much as we don't want to take chances, we don't want lives, we don't want to leave the livelihood of our people to chance as well. The high-level task force reaffirms its earlier directives on ban on shops that do not sell essential items, on bars, on clubs, on boda riders, matatus, the buses, the rickshaws, and the like. Only tea places have been given some sort of relaxation in the way they do their business. And instead of totally closing, they are given some conditions to observe. If they do, then they will be allowed to continue to work. If they don't, that ban can be reactivated.
What are some of those conditions?
Those conditions, one of them is to observe infection prevention procedures, meaning cleanliness and environment around you must be very clean. One. Number two, you shouldn't be able to allow crowding at your place. So the number of chairs that you put in your place should also be limited so that people do not have to wait. I would rather go for one chair only, at least for somebody who cannot stand. Drink their tea and they go. If that thing happens, there will be no crowd. But if you put there a lot of chairs, then definitely people will sit, they relax, and start crowding. Also, if you allow your place for playing dominoes or cards, then you are also attracting crowd. If you put their shisha service at your place, you are also attracting crowds, and you will not be allowed to operate. Restaurants, they can only work until 6 o'clock in the evening, but only providing the takeaway service. And you have realized also over the last few days there has not been really presence of the law enforcement agencies to see that these orders are being implemented in the spirit and letter. This is to give chance for people to start doing it by themselves. But time will come when it will be imposed by law. So also our people should start learning from now how they can actually do things without being coerced into it.
Is there any going to be lockdown anytime soon? Should there be no case of coronavirus? Will there be a lockdown?
Lockdown will be dictated by circumstances. That's one. Also, the plans by the Minister of Humanitarian Affairs and Disaster Management are actually ongoing, but also they are in line with the degree of lockdown we are going through. So at the moment, They are at the preparatory stage. And of course, when it comes to time implementation, people will be made to know. On the rumor, of course, after this point, we could not get the source for the rumor. Yeah, and definitely you cannot punish somebody you don't know. And for that reason, we can only tell people stop buying rumors, stop investing in rumors, because they can kill, they can cause devastation in a nation. And those who entertain themselves with rumors must understand that in as much as they're entertaining themselves, they are actually stabbing themselves in the heart, because it doesn't end there. It later on backfires to all of us. So it's important that we stop doing this. Confirmation of a case is done in a lab that we are partners in it with other organizations. And so there's no room for us hiding an information that is there. And we have been very much transparent. When there are cases where results were not clear, we have been talking about them, and we repeat the tests. And this is a normal standard being practiced all over the world. At times, you may not take samples accurately, and the sample that is not accurate may not give you the result, either positive or negative, as you wish to expect. So at times, you need to go back and redo again. So these are things that are known to everybody. So there's nothing that we can hide, because at the end of the day, hiding information will also backfire. It's like spreading rumors. Also, when it comes to a confirmed case, you will not find in the social media coming from a known source. It will come from the government. As you have seen today, a press statement from the office of the first vice president. If there's a case, it will come the same way, either from the office of the first vice president, or from the president, or from the Minister of Health, if they are delegated to do so. So, as we have always been saying this, the Minister of Health is the only credible source that you can actually rely upon. Yeah, that's one of the challenges, and we have to face it as a government. And people must understand the borders are closed. So if borders are closed, then whoever wants to evade those rules must also face the rule of law. Those who may be bribed, as you are saying, or if you know them, show them to us. We can also take measures against them. Yeah.
Thank you.